Right now, as you watch this video, there are millions of seniors over 60 with diabetes who are slowly losing their vision. And most of them have no idea it is happening. Not because they aren't paying attention, not because they don't care about their health, but because diabetic eye disease is uniquely, almost cruelly, designed to be invisible in its earliest and most treatable stages. By the time most people notice something is wrong with their vision, the damage has already been building for years. But here's the truth that changes everything. If you know what to look for, and if you act on it early enough, vision loss from diabetes is largely preventable. By the end of this video, you will know exactly how diabetes attacks the eyes after 60, the 5 early warning signs you must never ignore, and the specific steps that research shows can protect your vision for decades to come. So stay with me, because what I'm about to share could be the most important thing you hear this year. Let's start with a number that should make every senior with diabetes sit up straight. According to the National Eye Institute, over time, more than half of all people with diabetes will develop diabetic retinopathy, damage to the blood vessels in the retina. More than half. And according to research published in PMC, seniors over 60 are 5 times more likely to develop diabetic retinopathy than younger diabetics. 5 times. The CDC confirms that diabetic retinopathy is the leading cause of blindness in working-age American adults, and the risk only intensifies as we age. A groundbreaking 2025 study published in Scientific Reports found that seniors with diabetic retinopathy had significantly shorter survival times and higher overall mortality than those without it, meaning that diabetic eye disease is not just a vision problem. It is a whole-body health signal that demands urgent attention. And yet, survey after survey shows that the majority of diabetic seniors have not had a dilated eye exam in the past year. The gap between what the science tells us and what seniors are actually doing about their eyes is costing people their sight. And we are going to close that gap today. So what is actually happening inside your eyes when diabetes is not well controlled? Let me explain this clearly, because once you understand the mechanism, everything else, every symptom, every warning sign, makes complete sense. Your retina is the light-sensitive tissue at the very back of your eye. It is covered in an intricate network of tiny blood vessels, among the smallest in the entire human body. When blood sugar is chronically elevated, those tiny vessels become damaged. Their walls weaken. They begin to swell and leak fluid into the surrounding retinal tissue. In the early stages, this process is called non-proliferative diabetic retinopathy. The blood vessels are damaged, but new ones haven't started growing yet. This is the stage where intervention is most powerful, and this is also the stage that produces little to no noticeable symptoms in most people. As the disease progresses, the retina becomes oxygen-starved because its blood supply is compromised. In response, the eye attempts to grow new blood vessels to compensate, a process called neovascularization. But these new vessels are fragile, abnormal, and prone to leaking and bleeding into the eye. This advanced stage is called proliferative diabetic retinopathy, and it is the stage most closely associated with severe and permanent vision loss. For seniors over 60, this process carries an additional layer of danger. Research from PMC confirms that aging itself causes decreased blood flow to the retina, retinal thinning, and changes that make the eye more vulnerable to oxidative damage. When you combine the natural vulnerability of aging eyes with the constant damage of uncontrolled blood sugar, the progression of diabetic eye disease can be dramatically faster and more severe than in younger patients. This is why the warning signs matter so much, and why recognizing them early is not just helpful, it is genuinely life-changing. Are you still with me? Good, because here are the 5 early warning signs of diabetic eye disease that every senior over 60 must know, and that are missed far too often because they seem minor, temporary, or easy to explain away. The first warning sign is blurred vision that comes and goes. Many seniors dismiss occasional blurriness as tiredness, as a need for new glasses, or simply as part of getting older, but fluctuating, intermittent blurred vision in a person with diabetes is one of the earliest indicators that the retina is being affected by high blood sugar. The mechanism is straightforward. When blood sugar levels fluctuate significantly, they cause the lens of the eye to swell and change shape, which directly affects focus and clarity. According to the Mayo Clinic, these changes in vision may come and go in the early stages of diabetic retinopathy, and many people wait months or even years before mentioning them to a doctor. This delay is dangerous. Blurred vision that occurs with any regularity in a diabetic senior is not something to monitor quietly. It is something to report immediately, because it is often the first visible signal that retinal changes are already underway. The second warning sign is difficulty reading or seeing fine details, particularly in the center of your visual field. This symptom is closely associated with a condition called diabetic macular edema, which the National Eye Institute estimates affects roughly 1 in 15 people with diabetes. The macula is the small central area of the retina responsible for sharp, detailed vision. The vision you use to read, to see faces clearly, to thread a needle, to recognize a street sign. When fluid leaks from damaged blood vessels into the macula, that central vision becomes distorted, blurred, or washed out. Many seniors first notice this when reading becomes uncomfortable. Words seem to blur or shift, straight lines appear wavy, and fine print that was once manageable becomes increasingly difficult. According to the Research to Prevent Blindness organization, swelling of the macula is one of the most treatable forms of diabetic eye disease when caught early. But if left unaddressed, it can cause permanent central vision loss that no amount of treatment can reverse. If you have noticed any change in the quality of your central or reading vision, please do not wait for your next annual checkup. See your eye doctor as soon as possible. The third warning sign is seeing floaters, dark spots, strings, webs, or shadows drifting across your field of vision. Floaters are common in aging eyes and are not always a cause for alarm on their own. But in a diabetic senior, a sudden increase in floaters, particularly after a period of elevated blood sugar, can indicate that blood vessels in the retina have begun to leak or bleed into the vitreous, the gel-like fluid that fills the eye. According to the National Eye Institute, this bleeding into the vitreous is a hallmark of advancing diabetic retinopathy. Sometimes the blood clears on its own and the floaters diminish, but without treatment, scar tissue can form in the back of the eye, and the bleeding may worsen. The critical rule for diabetic seniors is this: any sudden appearance of new floaters or a significant increase in floaters you already have should be treated as a medical urgency and evaluated by an eye specialist within days, not weeks. This is not overreacting. This is protecting a sense you cannot afford to lose. Now stay with me, because the fourth warning sign is one that frightens people when it happens, and rightly so. It is the appearance of dark or empty areas in your vision, patches where you simply cannot see, as though part of your visual field has gone dark or been blotted out. This symptom suggests that areas of the retina have been significantly damaged, or that blood has accumulated in the vitreous in quantities large enough to block light from reaching the retina. It can also be an early sign of tractional retinal detachment, a serious condition in which scar tissue formed by advanced diabetic retinopathy pulls the retina away from the back of the eye. According to the Mayo Clinic and the CDC, retinal detachment is a medical emergency that requires immediate surgical intervention to prevent permanent total vision loss. If you or someone you love over 60 with diabetes experiences sudden dark patches, shadows, or missing areas in their vision at any time of day in either eye, call an ophthalmologist immediately. Do not wait until morning. Do not assume it will pass. This is a vision emergency. The fifth warning sign is one that many people don't associate with diabetes at all, and that is increased sensitivity to glare, difficulty with night vision, or noticing halos around lights. These symptoms are often the first indicators of diabetic cataract development. According to the National Eye Institute, having diabetes makes you 2 to 5 times more likely to develop cataracts, and at a significantly younger age than non-diabetic individuals. The mechanism is the same chronic blood sugar elevation that damages the retinal vessels. It also causes chemical changes in the lens of the eye that accelerate clouding and opacity. For seniors over 60 who already face age-related lens changes, diabetes compounds the problem significantly. Night driving becomes dangerous. Bright sunlight becomes painful. Indoor lighting creates halos and glare that make ordinary activities exhausting and disorienting. While cataracts are treatable with surgery, the presence of diabetic cataracts in a senior is also a strong indicator that the retina deserves urgent examination, because the same blood sugar levels causing the lens to cloud are almost certainly damaging the delicate vessels of the retina at the same time. Now let's talk about what the science says you can do, because this video is about protection, not just warning. The evidence is clear and consistent. Controlling blood sugar is the single most powerful intervention available for preventing and slowing diabetic eye disease. According to updated screening guidelines for 2026, the integration of AI-powered retinal cameras into primary care settings is now making it possible to detect retinal changes earlier than ever before, often before any symptoms are present at all. FDA-cleared AI systems can now analyze retinal images in minutes, enabling early detection that was impossible just a few years ago. This means that the bar for protection has never been lower, but it requires you to actually show up for the screening. The American Diabetes Association and the National Eye Institute both recommend a comprehensive dilated eye exam at least once per year for every person with diabetes, regardless of whether they have any symptoms. For seniors over 60, this annual exam is not a suggestion. It is a lifeline. During a dilated exam, your eye doctor can see retinal changes that are completely invisible to you, damage that is building silently, changes that can be treated before they threaten your vision permanently. Beyond the annual exam, managing blood pressure and cholesterol alongside blood sugar is critical because all three of these factors drive retinal vessel damage in diabetic seniors. Stopping smoking, if you smoke, reduces retinal vascular damage significantly. And emerging research is investigating whether nutrients like omega-3 fatty acids and vitamins C and E may offer additional protection for the aging diabetic retina, though these should be discussed with your doctor rather than self-prescribed. Have you had your dilated eye exam in the last 12 months? Do you know what your retinal health looks like right now? I want you to answer that question honestly. And if the answer is no, I want you to make that appointment today, not next week, today. Because the window to protect your vision is open right now, and the 5 warning signs we've talked about today are your body's way of telling you that window may be starting to close. Share this video with every diabetic senior you know, because the information in the next few minutes could preserve someone's sight for the rest of their life. And subscribe if you haven't already, because every week we're bringing you the most critical, evidence-based health information for seniors over 60 who refuse to accept that declining health is inevitable. This video is for educational and informational purposes only. It is not intended as medical advice. Always consult your doctor or qualified eye care professional before making any decisions about your health or treatment.